Welcome to Mental Health Matters and our YouTube channel, where we share information on all things mental health, plus give you an inside look into things that are going on at Palomar Family Counseling Service. Left untreated, mental health issues can have dire consequences for individuals, families, and communities, and we are on a mission to change that. Today, we are going to discuss how parents' mental health can have an impact on young children, and what mental health can look like for preschool age children. We'll also briefly discuss adverse childhood experiences. So it's a weighty topic, and I'm excited to introduce our guest today, Stephanie Rivera. Stephanie is a therapist here at Palomar Family Counseling Service, so I'm going to allow her to introduce herself, of course, but I'm going to start off with Stephanie, welcome, and give us a little bit of the Stephanie Rivera story.
Hi, David. Thank you for having me. Well, I was a preschool teacher for 10 years prior to being a therapist. I've worked with elementary school age children as well, doing after school programs. I did summer camps. I was working with toddlers for a while as well. So I have a pretty good knowledge of the early childhood years belt, so I've seen a lot throughout my career as a teacher and now as a therapist.
I bet. How long did you do early childhood education?
I did it about 10 years. I started working at the YMCA preschools when I was an undergrad, studying for my bachelor's in child development. That's where I first started working in the preschool setting, and I kind of got an interest for it. And so when I graduated college, I got a job working at kindercare, and that's where I got my first hands-on experience working in early childhood development. And I worked with Head Start for about 4 years.
Oh, awesome. Excellent. Excellent. So then you went on to get your master's degree?
Yes.
So now you've completed your studies and you are an associate therapist?
Yes, so I'm in transition from trainee to associate right now. So I'm currently seeing clinical clients as well as doing the MAC project program.
Oh, excellent. So yeah, for people who might not know, we have a contract with MAC Head Start programs, and that's the role that Stephanie is fulfilling. So tell everybody a little bit about the work you're doing with MAC.
So what I'm currently doing right now is visiting the various sites that they have, as well as the partnership sites that they have. Some of them are partnered with other child development centers or with home daycares as well, and just offering mental health consultation for the families that are in the programs, whether it's the parents, the children, or the whole family itself. Being able to be there as a support for the teachers and being able to consult with them and helping them out with any issues they may see in the children or in the families.
Excellent. Wow. Well, you certainly have the experience for it, so you're ideally suited to that role.
Yes.
So why Palomar? Why did you decide to join Palomar Family Counseling?
Well, at the time when I was looking for my practicum site, I found Palomar and I did my research on it, and I really liked what Palomar's mission was going for, and I saw that the population that I eventually wanted to work with works with them. So I thought this was a really great fit for me. I did my practicum here and now I'm employed here, which I really enjoyed my time so far. So
well, we're lucky to have you.
Yeah.
We're really lucky to have you. Glad that you were able to stay on with us. And I think this MAC role, or I shouldn't call it the MAC role, the role that you have working with MAC Head Start programs and their affiliated child development centers is ideal, and what a great resource you're going to be to all of those Head Start, those early childhood educators, the children and their families. So let's talk a little bit about this topic about parents' mental health and how it can have an impact on young children. Tell me so essentially what we're talking about is that if a parent is dealing with their own mental health struggles, maybe I'm not going to say this correctly, so please correct me. If a parent is dealing with their own mental health struggles, those struggles can have an impact on the young child.
Yes, that's correct. Typically, what I've seen in my own experience as a teacher, I have met some parents who confided in me and mentioned that they were struggling with their mental health and they had some issues going on, whether it was like depression or anxiety or just anything in general that might have had an impact in them, whether it was like minor or very major.
Yeah.
So with that said, children typically would start acting differently. They would start showing challenging behaviors in the classroom, or just a lot of very emotional stuff going on, like a lot of crying, or a lot of like temper tantrums, or just any like very different behaviors from the norm that they would normally experience.
Do young kids, so with how would you differentiate between, because I'm assuming that lots of young kids, when they're being separated from their parent, there's going to be kind of some sadness. They're going to be unhappy. Well, maybe some of them are going to be really glad, but there's going to be some sadness. They're going to feel a little bit frustrated. They might act out a little bit. When do you start to recognize it as kind of more of an issue?
Well, typically when children start school, especially if they've never been in a childcare setting before, it typically takes I would say about a month for them to adjust to like coming to school every day and knowing that, mom or dad is going to come later, this is going to be my routine now. So it's normal for the children to kind of like cry in the first couple weeks of them
Yeah.
going, and just kind of adjusting to the new environment, being with the teachers and whatnot, and with other children as well. But now, since if we see that it becomes something that continues even after the month of them being there, then that's when it becomes concerning.
Got it. Got it. So what tips I mean, let's say tips that we would give parents when they're first sending their kids off to preschool to make that transition easier or less stressful.
Well, what I would typically do is I would talk to the parents and just kind of explain to them that, to talk to their children, and like even if it's on the car ride over, just remind them like, okay, you're gonna go to school, you're gonna be with your teachers, I'm gonna drop you off, and we're gonna see each other later, and just kind of reassuring them that this is their new routine, and just talking about it also helps with them adjusting to this new routine that they have in their life.
So if a child is at home then and the parent is struggling with their own mental health issues, what can be done to kind of help that? And are you going to focus specifically just on the child or on the parent or on the family unit, or what would be the approach that you'd take in that situation?
In that situation, I would focus my time on the parent first, and just kind of getting an idea of what it is that they are struggling with, whether it's depressive symptoms or anxiety or any other mental health issues that they may be experiencing, and just kind of go from there and talk to them about, how do you think this is affecting your children? Like, have you noticed any changes in their behavior or anything different from them? How are the routines going, or, any different behaviors that haven't been exhibited before, and just kind of getting some background information on the child itself as well, just to see if it's something that it's the parents' mental health that's causing those behaviors, or is it the child that's having
Uh,
some other issues as well?
so what would you advise? So if I'm a preschool teacher and I'm potentially recognizing that a child has a mental, or how would I know as a preschool teacher that a child's behavior is more than just typical bratty little 3-year-old behavior or something? How would I know that there's more of a problem there?
Yeah, so typically like that would take us some time, because you take time to take them to get to know the child, and after you know the child, you kind of get to learn what their habits are, what their normal behavior is, and if you start noticing them, like for example, if little Johnny's having more tantrums than usual and he's just picking fights with other kids, or he's just not sharing all of a sudden, then that's like a red flag and a concern.
What are some of the symptoms that would be important to look for if I'm a child, a parent, or I mean not a child, if I'm a parent or a teacher, that might be an indication that my child or this child is struggling with mental health beyond just I guess, is it just acting out behavior, or are there other things that might be a kind of an indicator that something else is happening?
Typically, it's the behavior, just because
Mm,
children at this age are still learning how to handle their emotions and express them in a verbal way or just even by actions. So typically, I would say behavior. So, like if the child is exhibiting being very emotional all of a sudden and just having a lot of crying spells or temper
mhm.
tantrums or even anger issues would be an indicator of something going on, whether it's in the home or with the child themselves. Another thing to look out for is, let me think, aggressive behaviors as well as
Mm,
another one.
mm,
So, like if
mm.
they start getting aggressive towards their peers or even towards teachers, that's definitely something to look out for, especially if it
Any,
hasn't been done before.
yeah, that's what if it seems like it's out of the ordinary, like if you have a kid who's just typically, I'll say, full of lots of energy. So,
Mhm.
do you think is that what kind of education do teachers need in order to more comfortably address some of the behavioral issues they might be seeing in kids? Is that, I know we all hear about timeouts. I don't even know if that's what we're supposed to do anymore. I don't know if that's an effective technique, but what's the best approach for them to manage a child's behavior when they've got, let's say, how many other six, seven, eight other kids they're also looking out for?
Yeah, so handling these behaviors will obviously a lot of redirection. So just
Mm,
kind of like getting down on the child's level and explaining to them what they're doing is not okay. Just kind of reminding them, like if, for example, a child's hitting another child, just reminding them, like, hands are not for hitting. The use of social stories or even like visuals is a very good tool for them to use. So that way because children are visual learners. So that if they see what's appropriate behavior versus not appropriate behavior, then it's a lot easier for them to understand. And just having that constant conversation of what's appropriate, going over classroom rules, keeping our hands to ourselves and just, whatever works for the child.
how long do you think, and let me think if I'm asking this question right, like what amount of time is it reasonable for us to try and implement some kind of therapeutic service with the kid before we say, there's something else going on, maybe there's something, maybe they have a diagnosable disability or something else? Is there, like, do you determine, is there a window where you'd say, gosh, after 4 weeks and just kind of really trying to work with this young kid, there's nothing is getting better?
Mhm.
Am I asking that question right? Like, how would you advise somebody if they said, what should I do? I've tried all these things with this child or with my child, and he or she is just not responding the way we'd like them to.
Yeah, so typically if a teacher or a parent has tried multiple strategies and it's still becoming an issue, then that's when we would probably refer the child to, just to get an evaluation. Because a lot of
Mm,
the times, we don't want to assume like it may be autism spectrum disorder or it
right.
may be symptoms of like anxiety or even what's another one? A lot of maybe the child has some kind of developmental delays. A lot of the
Right.
times for this age group in particular, it's typically speech delays, and that's why a lot of the times children act out because they can't express themselves
Can't
verbally.
express
So they have
themselves.
to, communicate in other ways, whether, for them, it may be appropriate way to communicate, but for others,
Yeah.
it's not an appropriate way.
So oftentimes behavior is the communication.
Mm-hmm.
Um, so we can really respond to behavior as the child is trying to tell us not just necessarily just being, misbehaving for the sake
Yeah.
of misbehaving. Yeah, I know that when I worked with adults with significant disabilities, oftentimes there was something medical going on, and we tried to, the one response was to do behavior modification, but oftentimes it was a better idea to get them in to see their doctor because they might be having issues with their teeth or some other medical issue that we had to address first before we could even think about doing any type of therapy. So what is if you were identifying your preferred way of doing therapy, if you were doing therapy with a kid, or when would you decide to do individual therapy with a child, if ever?
I would probably do it probably as soon as we kind of know what's going on with the child, and
Mm,
we would go about that by doing play therapy, or some kind of art therapy would be helpful as well, just because the child may not have the full capacity of vocabulary to describe what they're feeling or
yeah,
what's going on at home. Sometimes kids do talk to their teachers and say like, oh, mommy and daddy are always fighting at home. And it's like, okay, well, what's going on there? And so,
right.
it all depends on the child. So just finding what suits the child is also a way to go.
Yeah, because I could imagine that if you're trying to initiate a therapeutic relationship with a child, it might be super intimidating at first. So if you
Mhm.
had some way to create a trusting relationship, whether it's through play or some other means, that would be kind of the ideal way to approach it.
Yeah. So definitely building rapport with the child would be ideal. And then that way we can get the ball rolling and figuring out what's going on.
How long do you think? What is the typical length of duration of therapy with a child, or is there such a thing as a typical length?
I think it depends on the child. Some kids can get better after, I don't know, maybe like 5 sessions. Some kids
Okay.
take longer. It just depends.
Should what sometimes there's a stigma even of saying I have to send my child to therapy, or my child is in therapy. Should parents be concerned about that, or should they just be comfortable with the idea that sometimes therapy can be as helpful as going to the doctor?
Yeah, and I've come across that a lot with a lot of families. They feel like they hear the word therapy and they automatically think, like, why does my kid need to go to therapy? Like, what's wrong with them?
Right.
And I try to explain to them this is not to make it look like a bad thing, is to help the child, and kind of think of it as like, when you're sick you go to the doctor, right? You're not just gonna put up with like a pain in your body, or you've had a cold for like 2 weeks and it's not going away. You're not gonna just ignore it. I try to explain it the same way. Your mental health should be taken care of as well as how you take care of your physical health.
Are there things that you would recommend to preschools, early start centers to be doing to encourage positive mental health, mental wellness in young kids?
Yes, for sure. Typically in the classrooms, it would be ideal to have, different social emotional stuff, which may include, flashcards with different emotions on them, or books about different emotions, social stories about, how to be a nice friend, or how to,
Mm,
there's a lot of books, like there's books that are, talk about hands are not for hitting or feet are not for kicking. Just little social stories that are written specifically for kids that age to be able to kind of get a understanding of what's
yeah.
appropriate and what's not appropriate.
Are kids ever, is there ever an indication like if a child's behavior is so out of control that they wouldn't that they wouldn't be going on to recommended to go on to kindergarten, let's say. Does that ever happen, or are schools having to adjust and come up with better strategies to serve all kids?
Well, the way it works now, I feel like there's so many interventions now and a lot of outside resources that are available to families now that I don't think that's really a thing anymore unless
Okay.
the child's birthday happens to land like right before the kindergarten cutoff, then they have to wait a whole another year if there's not a TK option. But other than that, I think because children as young as preschool age are already having IFSPs and IEPs, which individualized family service plans and individualized education plans. So that way they have goals for them and ways that they can accommodate to the child's needs.
So they can get the supports that they need even in a regular education system. It doesn't necessarily have to be in some type of segregated system, I
Yeah, so
guess.
like a lot of the Head Starts, they typically work with the school districts that are going to be closely working with the children that are going to be eventually going to these schools. So they kind of get the ball rolling with working with the school districts and having these children get the services that they need before they actually go to kindergarten.
Got it. So parents at home, tips for parents at home, how to create I'll say a mentally healthy environment.
Well, for starters, definitely validating your child's feelings,
Mm,
talking to them about their feelings and making sure that they understand that it's okay to be sad, it's okay to be angry, it's okay to be happy, but there's a time and place and how to handle that as well. And just reminding them that it's okay to be angry, but it's not okay to do X, Y, and Z. Like
okay.
teaching children
Okay.
appropriate ways how to express those feelings is an ideal thing as well, which I feel like a lot of parents don't really know like how to go about that. So that's
Mm.
one thing that I like to help parents with and just kind of giving them strategies that they could use at home as well.
Oh, excellent. So let's talk just a little bit about adverse childhood experiences. I was like, wow, what is that? So I did a little peeking at what adverse childhood experiences are and some type of traumatic events. But maybe you can share a little bit of your knowledge on what that is and how it might impact kids probably through the lifespan or through
Yeah.
at least through their teenage years.
Yeah. So adverse childhood experiences, or ACEs for short, is typically anything that's causes some sort of trauma in the home, whether it's a traumatic event or violence in the home, which typically is domestic violence or
Mm.
sometimes with the population that we work with, there's some trauma with dealing with immigration issues, which
Oh,
sometimes children are exposed to that and they develop some sort of trauma over that and being scared that their parents are going to be taken away and that they have to go live with someone else. So I've experienced that with when I was a teacher. I had a student where his father was taken by ICE because he
mm.
didn't have legal documentation here, so that kind of caused a little bit of post-traumatic stress disorder in the child as
Oh
well
yeah.
as the family. So that's definitely under the ACEs category, where like if these traumatic events don't get, they don't get the help that they need at the moment, it can cause later issues in life, like whether it's substance abuse or teen pregnancy or just growing up to be, especially in the like domestic violence, like if a child's exposed to domestic violence, they're either prone to becoming victims or perpetrators themselves.
Yeah. Yeah, I've heard about that, read about that, and I know with our family resilience project we talk about breaking that cycle of domestic violence, because indeed if you're exposed to that, it can, perpetuate into the next generation. Is
Yeah.
there What type of is the treatment different? So for if you're aware that a child has suffered some type of trauma, what type of treatment options are there?
Well, usually there is what is it, MDMR, I think it
Oh,
is.
right,
I'm
right.
not sure if
EMDR.
that can be
Yep.
used with children, but for sure, doing CBT is helpful, cognitive behavioral therapy, and just kind of going over emotions and just playing out, what happened and just getting them some of that exposure as well to help with the healing process is helpful as well.
Yeah. Yeah. Wow. Yeah, that's I never thought of the trauma that kids might experience through bad immigration experiences or separation from family for various reasons, or yeah, the the opportunities to, I don't know if the word suffer is right, but to experience adverse childhood experience or negative effects from some traumatic experience could probably, maybe it doesn't manifest itself right away, but maybe it would manifest itself in later teen years or even adult years.
Mm-hmm.
Wow,
Yeah,
wow,
so with the ACEs or adverse childhood experiences typically can lead to substance abuse, teen pregnancy, violence, growing up being an abusive partner, or even with health issues such as diabetes, heart disease, and the
wow.
list can go on.
Yeah, interesting. All right, all right. Well, that's why it's nice to know that there are people like you doing the work that you're doing and supporting a lot of the educators, early childhood educators, and certainly families to address any of the challenges that young kids are experiencing, so that they don't have to suffer um, later in life.
Yeah.
All right, we are going to end, but we always end these um, podcasts, or not always, because this is our second one, Stephanie. But we're going to end our conversation with, it's a guest question, a questionnaire, famously or notoriously used by James Lipton on Inside the Actors Studio. And yes, I'm a frustrated actor from many years ago. It was created by this French interviewer, Bernard Pivot. So here's the question, Stephanie. What is your favorite word?
My favorite word, I would say relax.
What is your least favorite word?
Hmm, Let me think. Toxic.
Those are good. What are you most passionate about?
I am most passionate about helping children and families and educate them on the importance of mental health and hopefully breaking that stigma that mental health has now and even in today's society.
Excellent. What bothers you? What annoys you, or is kind of like a complete turn off to you?
Something that annoys me is when I try to reach out to people and they don't follow through.
Mm,
So
yes.
like if I'm calling someone and they're not answering and then it kind of takes them a while to reply, I'm like,
Yeah.
what's going on?
What sound or noise do you love?
Mm, Sound that I like is the sound of rain and as well as oceans crashing, waves crashing in the ocean.
Just the best, right? I listen to that at night sometimes when I can't sleep. I'll put in my earphones and listen to rain noises or ocean noises. They're great. What sound or noise do you hate?
Alarms.
I guess that ties into that relaxed
Yes.
mode too. Got it. What profession other than your own would you like to attempt?
Um, I'm not sure. I would want to, I mean, I've already been a teacher, so I would probably want to, if I were to continue to stay in the education field, I would want to do more education administration and
Ah,
just kind of like being a director or even like a school psychologist even.
interesting. All right. All right. Last question. If heaven exists, what would you like to hear God say when you arrive at the pearly gates?
Mm, I would like for him to say, "You've done a lot of good deeds for
Ah,
others."
nice, nice. Finally, thank you, Stephanie. Thank you everyone for watching. Don't forget to give us a thumbs up down there and subscribe to our channel. And we will see you next time on Mental Health Matters. Thank you, Stephanie.
Thank you, David, for having me.
My pleasure.